Hello students, I welcome you all to Obstetrics and Gynecology with Mackler. In this module, we are going to discuss about colposcopy. So we are learning about the gynecological procedures which are performed for the cervix. In that array, in previous module, we have learned about the pap smear, right? In this module, we will be dealing with the colposcopy. So before starting with colposcopy, you need to know what is a colposcope, right? So basically, a colposcope is a magnifying instrument. So colposcope is a magnifying instrument, right? And this instrument is basically used to visualize the cervix, right? You need to visualize the cervix. So you are going to put a light and you are going to visualize the cervix. And that light is nothing but this colposcope, right? Can I show you the image here? Right. So what image you are seeing here is a colposcope, right? So through this instrument, you will be getting a focal light, right? Through that light, you're going to visualize the cervix and the further procedure is going to be performed. Now, you tell me, this colposcopy is basically a diagnostic procedure. Unlike your pap smear, which is a screening test, colposcopy is a diagnostic procedure. So depending on the results of colposcopy, we can plan the treatment, right? Okay. Now, the most important thing which you need to learn here is that with this colposcopy, you are going to take biopsy. Right? What is biopsy? You're going to remove that particular tissue from that area which appears abnormal. So anything which is abnormal, you're going to remove the particular tissue from that organ per se, and you're going to examine it under the microscope. So you're going to get it subjected under the histopathological examination, and this procedure is called as biopsy. So through this magnifying instrument, this instrument will give a focal light. Through that light, you're going to visualize the cervix, and from the cervix, whichever is looking abnormal for you, you're going to remove that part. And this procedure is called as biopsy, colposcopic guided biopsy. And this colposcopic guided biopsy is a diagnostic procedure. Based on the results of this colposcopic guided biopsy, the further treatment plan can be managed, right? Okay. So I told you that this is a magnifying instrument. So if it is a magnifying instrument, how much is the magnification and how much is the focal length? It is about 30 times. Okay, it is about 30 times. The magnification is around 30 times and the focal length is also 30. Is that clear? Very simple. Colposcopy, C is the third letter, right? So the magnification is 30 times and the focal length is about 30. And this is generally a diagnostic test. It is not a screening test. Pap smear is a screening test, whereas colposcopy is a diagnostic test. Is that clear? Okay. So what are the prerequisites? So before performing this colposcopy, you can perform urine pregnancy test if at all needed, right? Urine pregnancy test can be done before. As in every other single patient, right, before performing any procedures or before performing any test, the first investigation when a female come to you with complaints of bleeding, it is always the urine pregnancy test. So similarly, before performing colposcopy, if it is indicated, if the female is a perimenopausal or a reproductive age group female, you have to perform urine pregnancy test. So only after doing the urine pregnancy test, you can proceed with the colposcopic guided biopsy. Now, you may have a doubt that during pregnancy, can we do colposcopy? So the simple answer is that yes, during pregnancy you can perform colposcopy. It is because, see, colposcopy is a diagnostic procedure. Always diagnostic procedure is performed after the screening procedure, right? So if at all you're going to do pap smear in a patient, in a suspicious patient, you're going to do a pap smear, right? So in the pap smear, if the report comes to be LSIL, HSIL, or any other thing, then you are going to perform this diagnostic procedure, right, in order to find whether there is any cancer in the cervix. So basically, you are doing this diagnostic test only when it is indicated. So if at all it is necessary in a pregnant female, definitely you need to perform this colposcopy, because always the risk overweights the benefit. The risk is overweighing the benefit. Therefore, you need to take the risk and you need to perform the colposcopy guided biopsy. So if a female is pregnant, let's say around 16 to 20 weeks, some around, the female is pregnant and she is suspicious of cervical cancer, right? You did the pap smear report came to be HSIL, and now you're going to proceed with the colposcopy guided biopsy. So definitely you need to perform colposcopy guided biopsy under expertise in this female, because if you get to know that she is a case of cancer cervix, it is involving this particular quadrant, only then you can manage her during the pregnancy, right? Okay, so the answer is an S. Okay, so until now we have discussed that colposcope is a magnifying instrument. The magnification is around 30 times, the focal length is about 30, and it is a diagnostic test. Prerequisites as urine pregnancy test if indicated. It can be done during pregnancy because the risk always overweighs the benefit, right? And then the most important point here is that will you be able to visualize the exocervix and the endocervix, or only the exocervix or only the endocervix? We all know that exocervix or the ectocervix is the part of the cervix which is visible exteriorly, whereas endocervix cannot be visualized exteriorly, right? We all know that very well. So similarly, if you're going to put a light and see, you will only be able to see whatever is visible there. So what is visible actually? Only the ectocervix is visible. So if you're going to on this colposcope and the focal light is going to visualize only the ectocervix, therefore with the help of colposcopy you will be able to take biopsy only from the exo or the ectocervix. You cannot take any sample from the endocervix. Is that clear? It is very as simple as that. We all know that ectocervix or the exocervix is the visible portion of the cervix. So when you magnify this focal light, you will be able to see only the exterior of the cervix, that is the exocervix or the exocervix. Very important point here, I forgot to tell you in the previous module that the exocervix or the ectocervix is also called as portio vaginalis, right? Portio vaginalis. So you will only be able to visualize the exocervix or the ectocervix. You will never be able to see the endocervix, which is actually situated interiorly, right? Okay, so you will be able to visualize only the exocervix. So if you're going to visualize only the exocervix, then definitely you will be able to take the biopsy only from the exocervix. Is that clear? Yes. Then how are you going to take the sample from the endocervix? We all know that, right? We all know that from the ectocervix, the most common type of cancer is squamous cell carcinoma, whereas from the endocervix, the most common type of cancer is adenocarcinoma. So in order to rule out any lesions being present in the endocervix, we definitely need to perform some biopsy in the endocervix. And how it is being done? It is done through a procedure called endocervical curettage. Curettage is basically, you're going to take a curette and you are going to remove whatever specimen is available inside. You're going to introduce this curettage instrument inside and you're going to just scrap all the tissues whichever is coming, and you're going to put it in a bottle, seal it off and send for the histopathological examination. Is that clear? Yes. So for the exocervix or the ectocervix, you're going to do colposcopic guided biopsy. For the endocervix, you have to do endocervical curettage. Now you will ask me the question that you told me that from the exocervix, colposcopic guided biopsy can be done during pregnancy. What about the endocervix? So the answer is that only the colposcopic guided biopsy can be done during the pregnancy, because we all know that exocervix is the part which is visible exteriorly, but endocervix is not visible exteriorly, it is present interiorly. So it is, if you are going to introduce a curette and you are going to introduce it interiorly, you are going to cause some harm to the patient, right? She might have very heavy bleeding. So in order to prevent that, this endocervical curettage cannot be done during the pregnancy. The only procedure which is allowed during the pregnancy is pap smear and the colposcopic guided biopsy, whereas the endocervical curettage and the endometrial biopsy, which is the biopsy from the uterine cavity, it is contraindicated during pregnancy. Both are contraindicated during pregnancy. But in a normal female, in order to take the sample, you can take the sample from the exocervix by colposcopic guided biopsy and from the endocervix by the endocervical curettage. Is that clear? Yes. So now proceeding to the next step, what are the samples you're going to take? So I told you that from the ecto or the exocervix, you are going to take the sample. Now, what are the samples you are allowed to take and what you are not allowed to take? So, in the cervix, if there is any rough, friable area or the lesions present over the cervix, you definitely have to take biopsy from the cervix, right? Let me show you here. If you are going to see here, some rough areas, right? Some rough areas. Now, from these areas, you are going to take biopsy. You have to take biopsy from such rough areas, right? So definitely rough friable lesions over the cervix, you have to take a biopsy. Biopsy is very important. Is that clear? Yes. So what is a Nabothian cyst? Are you going to take a Nabothian cyst? Nabothian cyst is actually a blocked glands which are present in the cervix. So are you going to take any sample from the Nabothian cyst? We all know that this Nabothian cyst is because of a blocked gland in the cervix. So because of the blocked duct in the cervix, you're not going to touch it. So you're not supposed to take biopsy from the Nabothian cyst, which is basically a blocked duct, right? Okay. So I told you that in the cervix, if there is any rough friable lesions, you're going to take a punch biopsy. And then if there is Nabothian cyst, you are not going to disturb it. You're not going to take